Austin Gillard, CEO of Clay County Medical Center. I've had the opportunity to be at the facility for 7 years now. The biggest thing at a facility like Clay County Medical Center, on average, we're seeing 10 to 15 patients a day through our ER, so it's very important to keep the emergency department staffed. Primary care shortages within the state of Kansas has led our providers to be extremely busy in the primary care clinic, so they no longer had time to staff our emergency room full-time like they did 10, 15, 20 years ago. So the partnership with Docs Who Care has filled that void when needed.
I'm Brittany Emke from Hanover Hospital. I'm currently the administrator here in Hanover, Kansas. We are a 25-bed critical access hospital and rural health clinic. I have moved here from Kentucky about 13 years ago, and I worked in Hanover most of the time since I've been back. Our partnership with Docs Who Care has allowed us the flexibility for our providers, the few that we have, to maintain their home life and have that time off. It allows them to go be with their family or go to a kid's sporting event and just help with that coverage of call. It's been tremendous and a huge asset for us to maintain that relationship.
Over the last 2 years, we continue to hear the word burnout, or providers are feeling overburdened not only by COVID-19, but with EMR and insurance prior authorization. So the more burden that we can take off of our medical providers, and we can staff the ER separately, for instance, at Clay County Medical Center, which we do, we've been able to come out ahead on provider satisfaction. And that's been a huge benefit of bringing Docs Who Care into Clay County Medical Center.
Today has been kind of a whirlwind. We are, as other rural facilities, shorter staffed. We have a provider that was out on training, a provider that needs to go be a family member. Then my provider got sick today. And so that was at 8 a.m. and I'm calling Docs Who Care already. And by 11:30, we have coverage, and it is tremendous, because otherwise my other provider would have missed her granddaughter's graduation. Docs Who Care is fantastic. They completely integrate with your staff and your system, and they know rural healthcare. They know how you practice. They don't come in and overturn everything. They just completely integrate, and they become part of your family too.
The community's been very supportive of, again, the Docs Who Care providers. They're well screened, they're competent, they provide high quality health care. So I think that's really helped move that along. And that goes back to that comment where they understand rural health care. We're not working in a level 3, 2, or 1 trauma center. At the end of the day, I think Docs Who Care understands a true partnership on what it means to partner with a rural hospital. Again, whether a small PPS hospital or a critical access hospital, they can do it all. So they provide a consistent quality product, which is their medical providers, to facilities like ours.